So the second to last speaker is Dia Jancic. Jancic, did I spell it correctly? Yes. Dia is the EU project manager at IoT, which is the Alliance for Artificial Intelligence, Internet of Things, and at Continuum in Brussels. Her academic background is in economics, EU policies, and business administration. She has extensive expertise in donor-funded projects, coordinating large international consortia and ensuring alignment with EU policy priorities. Currently, she coordinates the ENACT project, which explores the environmental effects on healthcare, well-being, and active interventions. The project has a total of 21 partners from Belgium, Spain, Estonia, Greece, Italy, Bulgaria, Finland, Ireland, and the Netherlands. So the floor is yours.
Thank you so much.
And I will give you...
I'll do without because I have just two hands.
Do you want me to pass them for you?
Yes, please. Thank you. Thank you so much. Thank you. Thank you, everyone. I had the pleasure to listen to the coordinators of the previous projects. I'll do my best to present this from a non-scientific perspective to anyone who is from a non-scientific background. I'll be happy to have a chat after and introduce you to my colleagues who are also here in the audience. I will introduce you to ENACT, that stands for Environmental Effect on Health. Oh. What? Thank you. On environmental effect on health and well-being and active interventions. The scientific challenge and, oh, no, the previous one. I think we're going to stay on it for a little bit. Thank you. Thank you for mentioning that we have 21 partners in 10 countries, but we also have 5 pilot studies that are in the preparatory phase in 5 countries, including Belgium, Bulgaria, Ireland, Italy, and our host country here, Spain. So together we're tackling one of the most pressing challenges in Europe, the impact of environmental stressors on non-communicable diseases, which account for 80% of EU's disease burden, which is a very important percentage. What we do mean by environmental stressors, we mean water, noise, allergens, humidity, that are responsible for non-communicable diseases, but we also are focusing on cardiovascular diseases such as respiratory, ocular, dermatological. So the major drivers on non-communicable diseases are those here. However, we are also including emerging stressors such as electromagnetic fields and light pollution, which are more and more linked to ocular and dermatological diseases. We conduct exposomic research, not me per se, the experts, which means studying how lifelong environmental exposure affect health with the aim of moving from treatment to prevention, with an accent on prevention. The exposomic research conducted takes into consideration retrospective and prospective studies. Here is what is interesting. The prospective study, for example, takes into consideration cardiovascular diseases. In Bulgaria, one of the pilot study countries, we're looking into, for example, myocarditis. Then heart failure in Italy. And non-cardiovascular diseases such as dermatological diseases in Ireland. Asthma and allergies from different allergens here in Spain. Research in Spain, my colleague who left briefly the audience brought a very important and interesting information, which is the consideration of pediatric data that are being taken into consideration as well, because while we may be focusing on allergens affecting our niche, we are also very much interested in knowing how this affects future generations. We're building a scalable AI-powered data infrastructure model, respective of ethics, transparency, but most importantly, patient privacy. We have an ethics advisory board, very important to mention too. So to resume this first slide here, without going too much into the details, but of course, we're focusing on policymakers and hospitals that are the main beneficiaries of our project. We combine epidemiology, exposomics, clinical data, and data science tools, including AI and real-time monitoring to map the full chain from exposure to biology to disease. Maybe the slides don't like me. Next one, please.
I'm trying.
Speaking of AI. Thank you. So the scientific challenge and the context lies in the exposomic research, translating the data from the population level to the individual level. And ENACT is designed in such a way to predict, to monitor, and prevent the exposomic risk, that is, the lifetime environmental exposure of acute and chronic health conditions. So to do this, we will develop an environmental risk score and analyzer platform that supports 3 key groups: citizens, health providers, and policymakers. Sorry, wrong coordination. For citizens, the project offers early detection, prevention, and empowerment through personalized exposomic risk awareness. For health providers, we provide training, clinical support, and population health management tools. And for policymakers, we deliver transparent policy briefs, evidence for urban planning, and guidance for reducing the financial burden on health systems. The major outcome will be the environmental risk score, translating interpersonalized risk scores to benefit the citizens, and help tailor interventions to support health providers in better prevention to reduce the burden at the national levels. Very importantly, we have the commission here. At the policy innovation level, the project will, we're still in the previous one, but it's okay. The project will...
Do you want to go back?
Por favor. Thank you. Very importantly, at the policy innovation level, ENACT will provide evidence for better urban planning and health governance, creating scalable models for urban health resilience, promoting inclusive and proactive care. So next one. Thank you. On the scientific approach side, there are 4 pillars for innovation sustainability, focusing on impact by design, so the social impact, the evidence base, and the innovation adoption. So the scientific approach, resting on those 4 pillars, will ensure that innovation translates into real practice, tailored to diverse end users, and integrate behavioral change, not only technological advances. Next one, please. Thank you. Yes, I think I'm going to skip this one as well because I mentioned, thank you, key expected results. Throughout the 5 pillar pilot sites that are being currently conducted, actually in preparation, we will clarify how pollutants, greenhouse gases, UV radiation, allergens, humidity, and noise contribute to major chronic infections. We will study interactions between environmental and non-environmental stressors, especially in relation to acute hospital admissions. So there is also a focus on acute and non-acute, and preclinical stages of disease. We will also provide actionable evidence and recommendations to strengthen the EU and global pollution management strategies. One more, please. The expected political and societal impact will be focused on the broader impact. So it will create a transformational infrastructure that links environmental intelligence, predictive health, and policy innovation. How will we do this? We will do this through rigorous data collection, which is a very important aspect ongoing, and integration, evidence aggregation for causal inference, and systematic evaluation and benchmarking, which are essential for scientific validity, policy trust, and governance. The expected outcomes are stronger, more resilient health systems, reduced financial burdens, and scalable models that can be adopted in Europe. To conclude, maybe I'm speaking faster than the rest, ENACT is about turning environmental intelligence into prevention and action by connecting data, technology, and governance. The end goal is to make urban living healthier, more equitable, and more sustainable. Thank you. And of course, more information as well on the website. Thank you.